Oral immunotherapy for treatment of HA allergic in children. What does oral immunotherapy?
For kids that are egg allergic, they're likely from a family that one or both parents have one of the allergic diseases, not necessarily egg allergy, they just have allergic disease. And then they were exposed either in utero or through breastfeeding or topically. We don't really understand this part to egg. And so put those two things together, then that's why 2.5% of kids develop egg allergy.
How many people have a food allergy? In the United States, 4 of 10 have a food allergy which affects health, and quality of life. In accord, 4 children have each allergic stop upon reach the age of the at 16 years. What is an allergy?
When we have a patient, typically a child who's got egg allergy, they usually grow out of it, often by the age of 3 or 4. And we need to, because egg can actually be fairly problematic in the type of reactions it can cause some nasty reactions. We want to make absolutely sure that the child is safe and not going to react. And what we do is we'll do skin prick tests to look for reactions in the skin. And we'll ask the parents, if the child's had any accidental contact and if they've reacted. We do a skin prick test and it's turned from positive to being negative. We think the child has probably grown out of it. But what we need to do is, in a controlled environment, test that child to make sure. We don't always get it right with the skin prick tests or the blood tests. And sometimes that child might actually still be sensitive. So we will either bring them into the ward or we'll do it in outpatients. And we'll do what we call an egg challenge. That involves asking mummy or daddy, whoever the best cook is, to make some scrambled egg and bring it in. And then what we do is we start off, we put a little bit on their skin, we wait 20 minutes to half an hour, we'll put some on their lips, on their tongue, get them to swallow a little bit, get them to swallow a bit more. If at any point we get a reaction, so for example if the side of the lip starts to swell, or if they get tingling in the mouth or their tongue starts to swell, we'll stop, we won't go any further. And we know that they're still sensitive, and we'll get them back after another period, say typically another year. But if all goes well and they can tolerate the egg, we say bye-bye, go and have some nice sort of quiche or whatever you fancy, egg custard, and be happy.
Goal of allergy immunotherapy. The goal of allergy immunotherapy is to produce a more sustaining clinical effect than desiccated, including immune tolerance.
Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. A new report published in the New England Journal of Medicine finds that exposing children with egg allergies to very small doses of eggs over an extended period of time may reduce or even eliminate their allergic reactions. Here are some symptoms of food allergies. Skin symptoms including hives, angioedema, and itchy red rashes. Respiratory symptoms including cough, wheezing, and throat swelling. And GI symptoms including severe abdominal pain with vomiting or diarrhea. Researchers from the University of North Carolina studied 55 children who were allergic to eggs, randomizing 40 to oral immunotherapy and 15 to placebo for 10 months. The oral immunotherapy consisted of very small daily amounts of powdered egg whites, with the amount gradually increasing every 2 weeks. Children were followed for up to 3 years, periodically taking food challenges to assess their sensitivity. After 10 months, 55% of children taking oral immunotherapy were able to eat 5 grams of egg white, passing their food challenge, compared to none of those taking placebo. After 20
Oral immunotherapy versus subcutaneous immunotherapy. Oral immunotherapy appears to be safer than subcutaneous immunotherapy for food allergen and induces the desensitization. Area of children with food allergy to eggs that have undergone oral immunotherapy deliver higher threshold of tolerance for this food, but the positive effect is greater if treatment continues permanently because if it is left can be reduced tolerance again. Food allergen supplementing treatment through oral immunotherapy.
What food are you doing now? Cash. And what food have you already finished? Peanut. Do you like peanuts? For the past 5 years, we've been treating children with food allergy by giving them very, very, very teeny doses of the food that causes their reactions and gradually increasing that dose so they reach a point where they can eat the food regularly without having any reactions or problems.
This round, he's being treated for cashew. Cashew on him was actually a little higher, a little more potent than peanut, so they did peanut first. He graduated with that, doing the peanut flowers and peanuts. Got up to 20 some odd peanuts a day, so can eat any.
Thank you.